Good evening and welcome to Burn News and Views. I'm your host, Don Burgess, and with me today is a very distinguished panel of doctors. Starting on your screen to your upper left is Dr. and if I butcher this, please forgive me, Armani Ossoran.
Yes. Good evening.
Good evening. Dr. Aisha Peets-Talbot.
Good job.
Dr. Henry Dowling.
Good evening.
Dr. Cooney Frith.
Good evening.
And Dr. Armani Robinson, MD. All right, thank you. We're going to start, and we're going to let each of the doctors introduce themselves in the terms of who they are, why they're here, and why they think getting out an alternative voice is important. We'll start with Dr. Ossoran.
All right, so I'm a general practitioner with Island Health Services. During the onset of the pandemic, I served as the interim clinical director for long-term care, and so was responsible for managing the outbreak in the rest homes. I saw those patients on a daily basis, every patient in the two rest homes that had the outbreak. I've also served as the supervisor for the Southside swabbing facility, and so have conducted thousands of swabs and supervised tens of thousands during our national COVID response.
Dr. Peets-Talbot.
So I'm Dr. Peets-Talbot. I am a functional medicine practitioner or holistic health practitioner. I'm board certified in pediatrics, internal medicine, and obesity medicine. It's a lot to keep up with. And I co-founded a holistic health practice called Ocean Rock Wellness. I spent part of my time there. I also serve as the medical physician for Mid-Atlantic Wellness Institute, where I help out the psychiatric team there to manage any physical or medical complaints that come up with the clients that are a part of that network.
Okay, thank you. Dr. Dowling?
Yes, good evening. So I am a family practitioner, works alongside my wife, who's a chiropractor, associates in integrated health. During the past year, I was also the president of the Bermuda Medical Doctors Association, basically the largest group of private practitioners here on the island, trying to assist in coordinating care between doctors and patients.
Thank you. Dr. Frith?
I am a classical traditional naturopath. Most people will know me from running Herb Goddess teas in the Washington Mall. I have a background in auricular acupuncture, clinical hypnotherapy, and just a host of natural modalities that surround holistic health.
Thank you. And certainly not least, but last in this case, is Dr. Flood Robinson.
Yes, hi everyone. So I'm Dr. Armani Robinson. I am a qualified licensed naturopath licensed in the state of California. I'm in practice at a local full-service medical facility here in Bermuda. People know me and know where I work. I founded a local group called the Bermuda Iremectin Resources and Advocacy Group, BIRA.com, in order to advocate for the safe and effective use of ivermectin in the war against COVID-19 in Bermuda.
Thank you. So why has this group come together and decided to form an alternative voice on issues regarding COVID? Maybe Dr. Ossoran or Dr. Dowling?
I don't think we're serving as an alternative voice. I just think that there has only been a very streamlined approach to it, and we're keen to give additional information. I think that we practice traditional medicine. I don't think that this is alternative information. This is what we usually do when we're dealing with illnesses, studies, research. We usually give objective information.
Okay, so maybe an alternative might be a bad choice of words for me, a different voice than what the standard line that's being given by government.
I like to use the term adjunctive. So what we're trying to promote, at least myself, is therapies that can serve alongside of the conventional medicine. As an alternative medicine practitioner, that is just an umbrella term that just means offering people more than one option.
How do you think the Beyond the Pandemic TV series, which launched yesterday with the first episode, addresses these issues?
I think it's a start. I think, for too long, we've heard very narrow scope of what is available for patients and populations out there in terms of what this pandemic is all about, whether it is its origins, how best to treat patients, how best to manage patients before they get very sick. All of this has been very focused on a few targeted objectives and not the full scope. And in most doctors, we want to give patients all of the options and then give them the freedom to choose which option is best for them.
Now, Dr. Dowling, you starred in that first episode with the series host Eugene Dean, and we have a 2-minute clip of that, if we can play that.
An eye-opening series that's breaking the silence, revealing true stories, and sharing solutions to help us get beyond the pandemic.
So the government being what they do, they bring in people that they feel comfortable will share in their core values and in their initiatives and their directives. And so there were select doctors from whatever organizations that they picked, and they used them to kind of help shore up whatever medical advice they had. And you have some doctors who will always kind of push against the edges of what the standard protocol is, and then you'll have some that will just say, no, we have to wait till the chiefs give us permission.
I know there's been a lot of conversation, or you hear a lot of politicians around the world, well, just authorities in general, trust the science.
Mm-hmm. Yeah, so I do agree that we should trust science. The problem becomes that most people don't know the science. What they do is they know either scientists or they know politicians who say trust the science. So ultimately you decide to believe the person and not the science.
I got concerned when I would see doctors pleading with politicians to listen to them. So I'm saying that I'm confused now,
right?
Because I'm thinking that doctors, medical professionals, experienced ones particularly, should be leading this conversation.
You are not able to express a different opinion from the mainstream any longer. And that is scary, especially as a physician who, you have credentials behind.
So how do we have an objective conversation in an environment that's pretty much, aggressively attacking objectivity?
You answer that question, you're going to be the premier next. But I think...
For more information, please visit our website, beyondthepandemic.tv, or email us at info@beyondthepandemic.tv.
So in that first episode, Dr. Dowling, what are some of the other things that you discussed with Eugene Dean?
Well, I think my main reason for even going there was to inform the viewers that, we have an opportunity here not to live in fear, that we actually have options that will keep patients from entering in the hospital. As a family practitioner, I believe that's my main objective, is to keep people healthy, so healthy that they never have to step foot in the hospital. And for all of this pandemic, we were told basically, swab patients, and then those who get positive, wait till they're so sick that they go to the hospital. We gave them no options but to just wait and hope. And yet behind the scenes, there were many physicians who were finding alternative ways of treating patients so they didn't get sick. There's a difference between infected and sick. And we wanted to give these patients an option other than just sitting and waiting for a vaccine that might be here or might not. And all of the eggs got placed in the vaccine basket. And here we are now still doing that. We're telling patients you have vaccines or locked away while you wait to get cleared of being free from COVID. My objective was simply to tell people you have other options and you get to choose. You do not allow the government to choose for you.
Right. So what are some other optional treatments that yourself and maybe a couple of the other doctors here have been giving to patients or helping them with either prior to getting sick or after they initially test positive for COVID?
Well, for my patients, actually most of them have been okay. I think we spent so much time focusing on the idea that this is a deadly pandemic instead of actually looking at what positive patients look like. The initial outbreak in the rest homes, those patients were all elderly. They had lots of comorbidities, and they were managed very well. They did well. In private practice, it's the same thing. I think most of the patients who end up being positive, the issue is with their fear and what they think will happen. But I've sent one patient of the approximately 100 positive patients that I've managed directly. I've sent one to the hospital, and it wasn't because she was in distress. It was because oxygen was low, and I thought it would be responsible of me to send her. She didn't have an increased respiratory rate. She wasn't uncomfortable. So I haven't seen evidence that if you get COVID, you're doomed.
Yeah,
and that's
same
what directly seeing patients.
Yeah, same with, I mean, my experience is the same with Dr. Ossoran. You have patients who were 90, COPD, in nursing homes who got COVID, were infected, who really did well. My clients in practice, I actually really kind of try to address the fear factor for them. They're like, oh my goodness, got COVID. I'm like, congratulations. Like, this is a good thing. This means that your body is going to get natural antibodies. But then we talk about, what they need to do nutritionally, what they can do to increase their vitamin status, maybe extra vitamin C and zinc or vitamin D, just amazing things that they can do to really help recover naturally. And what I've been seeing with my clients, and mind you, that's my dialogue, period. It didn't really take COVID for me to be like, you need to eat right and take a vaccine. I mean, take some vitamins. But that's, it really heightened when that came about. So I'm really proud of my patients and how they've been doing, but they've been doing really, really good, I had one patient that passed away. He was an early fatality, and he had a lot of comorbidities going on before that. He really was walking a thin line, but it's been pleasant for me on the outside because I've been in the flu pandemic, the H1N1 10 years ago, and I was running up and down a hospital ICU like with a chicken with a hair cut off type of thing, and seeing people really going down the tube. And then that's kind of how I became more of a preventative person like Dr. Dowling. Let me take people, get them, better so they don't even really need to go into the hospital. So that was a big switch up for me 10 years ago.
So just listen to what is being said here tonight and how different that is from the updates that the public were receiving about COVID. There was just a lot of fear mongering, nightly death toll, or, positive case rate. And in my mind, this was news you can't really use. Like, what can you do with that information? But what the doctors are talking about now is news that you can use. Likewise, the reason why I started the Iremectin support group is because once I became familiar with this potential treatment, I was truly fascinated by the positive results that were being shown in the evidence as it emerged, and I became convinced that ivermectin could be a very important tool in the fight against COVID. At the clinic where I'm employed, we began using it at some point a couple of months ago, and we found that every patient that was treated with ivermectin did quite well in both symptom reduction and in shorter recovery time, and et cetera. So once again, the reason why I joined this group and the reason that I felt that we came together was just to be able to promote a more positive, a more helpful, and more useful information that the public could really do something with to either help them cope, help them understand, help them do better, and get well and not be afraid. I've seen patients, bawling, crying tears on their diagnosis saying, am I going to die? Am I going to die? And we just did not need that. It simply was not helpful.
Right. Would you say there were other things? Because you mentioned the daily numbers of people who test positive and people when they announced when people were death. What else would you consider like was fear mongering?
That's not enough.
Okay.
In other words, where was the positivity? Where was news as it emerged about recovery, how to manage at home, what you can do to make yourself more comfortable, what you can use? I mean, instructions to simply call the hospital once you are unable to breathe. That's a fearful thing right then and there. I think a lot of people would stop breathing just on knowing that that may be their fate. So why not talk about emerging evidence about vitamin D and its efficacy and being a preventative, zinc? With when we began using ivermectin, it was promoted by a group of frontline workers called the Frontline COVID Critical Care Alliance, and they actually put together numerous protocols, including a preventative protocol, a treatment protocol, and they included nutrients like vitamin C and zinc and vitamin D, quercetin, and melatonin. And those nutrients are actually shown in a lot of clinical research to be effective both at boosting one's overall immune system and also in the mechanisms of action of the infection of and progression of COVID-19. So that those would be helpful things that could have been talked about, and personally, I did not hear them.
Yeah. We'll start with Dr. Dowling. What sort of things have you learned over the last 14 months with regard to COVID and the pandemic?
Well, I mean, what I've learned is that this particular virus is very similar to its predecessors. You know, we initially said that it was a coronavirus. We went ahead and said what coronavirus typically did. It was a respiratory virus. And then all of a sudden, you know, we were told, oh, you gotta, you know, it can end up being transmitted because if it lands on your table, it's still alive. You know, we were getting so much conflicting data to what, you know, instinctively we knew about viral illnesses. Oh, well, you know, as Dr. Peets-Talbot said, well, you know, congratulations, you caught it, you got over it, now you got antibodies. But then we were told, hey, those antibodies aren't going to be around or they're not going to help you. And now we're getting more of the true data to show you that actually they are sticking around and that they do help you. We were getting so much conflicting data, and unfortunately the data that we were getting conflictions about were from the primary sources that the politicians were putting all of their trust in, the CDC, the World Health Organization. But if you talk to the doctors out on the front line, the ones who didn't have access to a lot of financially expensive drugs, those were the ones that were actually seeing a lot of positive results from stuff that is in a lot of, you know, places, everyday medicines. So, you know, you started off with the hydroxychloroquine, which did show some promise, not as much promise as ivermectin, and is actually still used today. But it was so quickly demolished as a possibility, and it was attacked, you know, politically, that it was no longer looked at critically. And I think that's been the problem. We've been mixing politics and finances with medicine, which is a dangerous thing. We see it here in Bermuda way too much.
Right. So when you talk about it being mixed, where do you see it, the politics and the science?
Well, for one thing, you know, when it started out very quickly, you know, we were asking as the Bermuda Medical Doctors Association to be more involved in the collaboration of the different organizations on how we should manage COVID. And, you know, basically we were told, well, you know, we'll let you know what we need from you, basically. And I'm paraphrasing big time. And so automatically you had a large group of frontline doctors here who were basically isolated from what was truly being created as the way forward here in Bermuda. And we didn't even know which doctors they were picking. We didn't know what was going on unless they decided to tell us. And if there was, God forbid, there was a leak of information beyond just the few that was told, all of a sudden they shut their doors even more. So it was very frustrating for us to be kind of left in the dark when we're the ones who have to see these patients despite COVID. You know, heart attacks, strokes, diabetes, they kept going even though COVID was raging. We were expected to go into our offices and manage them the best they can. Sometimes it was just us because we had to send our workers home. and yet we did the best we can. I give the doctors here much praise for how they, the job they did.
And Dr. Peets-Talbot, how have you seen, what sort of things have you learned over the 14 months of this pandemic?
Oh, goodness, so many lessons come out of it. What strikes me about this whole, COVID pandemic that we're seeing is a bit about of attraction. So stay with me. There's been laws that have been put in to allow such like a vaccine to come about. Like even pretty much around my time being born, like 1980s, government, especially U.S. governments, were already preparing. Hey, in the event that there was a virus or some type of bioterrorism mechanism, we need to have like laws in place and things in place that allow for us to have a very quick response. So this is kind of really interesting that in a lot of ways it's kind of like we're been prepared for it. And now and I always thought that this whole bioterrorism is something that you already background in your training. Could it be like anthrax, right? One of the biggest things. Like, and being a frontline physician, you kind of always have your guard up about these things. And so now we have, this virus, COVID, being released from, a virology lab, essentially, a synthetic virus, So, and now, when we have this kind of quick response of, the vaccine, so it's been really interesting to see how, in our history, humanity's history, that, we've kind of are living through this. I would be really interested to see true like mortality numbers for Bermuda. I think that's kind of really interesting for me. I think that there may be some other things, but I also learned that human race is also very resilient. I have known so many people who are just rocking and rolling with it. I couldn't imagine doing as much telemedicine as I'm doing now and still having the impact that I'm having. So kind of getting that superpower and getting that is kind of really, really cool, because I love to be hands-on and I love to touch my patients, and I'm a hugger, so I'll hug them too, so that sort of stuff. So it's kind of been really interesting, but it's really touchy, it's kind of learning, we are adaptable is what I'm learning mostly.
Okay. Now I know we talk about WHO or the CDC or NIH, but like a lot of times they're not even in the same, they don't all aren't in lockstep together, and each organization has their own recommendations that don't match necessarily the other two. One of the things I guess I found was interesting was in England last month, they allowed school kids to go back to school without any mask on. What do you think? What is your opinion about our school kids? Can they go to school without having to wear a mask?
Yes. Yes. Yes.
And yes.
Definitely.
I wish that what I had learned was as positive as those testimonies. But I'm sad to say that what I learned is that some big organizations just can't be trusted. I won't trust them with my life again ever, because the fact of the censorship, the misleading stories, the outright lies. I really lost a lot of confidence in conventional medicine, not individual practitioners. I'm here among some very erstwhile and very honest and sincere practitioners, and they exist all over the world. But I also learned that in some instances, you really have to reach out and trust yourself and go ahead and blaze a trail where there may not be a trail. And just relying on organizations that may have ulterior motives is just not the way to go. So that was my lesson. It was an eye-opening, very difficult lesson to learn.
Dr.
Dr. have a lot of, but that's a really, really good question. You know, the regulations that have been put in, you know, place for these students, it really is concerning. I'm a mother of 3 young kids. So I have a 7, a 5-year-old, and a 2-year-old. Now, the 7 and the 5-year-old, you know, recently kind of went through government camp and had to test every Friday. And they also were kind of isolated in their pocket. So they really, there is a psychological effect. It started off very fun for them, but then they started to actually not really want to go. I had to pull them out early because they was like, I don't know what's wrong. Every day is great except for Fridays. We have to get tested. I can't play with anybody. I can't meet anybody. Kids are very social creatures. So we have to kind of think about that. And we haven't been thus far.
Dr. Frith,
And the simple fact that they were at such a low risk as children to the virus, I don't think that was fully explored, explained, or taken advantage of as far as allowing them to have those freedoms and still be safe.
Dr. Frith, what are some things that you learned over the last 14 months?
I would have to say that the population I dealt with over the last 14 months basically were interested in just maintaining a healthy regime in terms of diet, in terms of supplements, in terms of herbs, and not really wanting to submit to pressure for taking the vaccine. I would say that I have been out there delivering herbs to folks who were diagnosed with COVID, and also just to folks who were wanting to protect their immune system, keep their immune system boosted. And that was from very young children to the elderly, people in their 80s and 90s. And it just, it gave me the opportunity to connect at a grassroots level with what people were prepared to do in terms of just maintaining their health.
Okay, thank you. In general, what are your stance on masks? We'll start with Dr. Ossoran.
I think they serve a purpose in preventing spread of actual droplets, but to just be having them on constantly, asymptomatic people where the likelihood of transmission is already very decreased, I don't see that as necessary. I think I base that more on personal evidence, having worked in the enclosed environment where everyone was positive, and we're on a small isolated island. So we ran out of fit N95s, and we ran out of the entire suits, and ran out of a lot of supplies. And so we learned over the days what was really necessary to keep us safe. It ended up just being the masks and gloves while dealing intimately with the patients. But beyond that, when they weren't on, we didn't turn up positive. The people who worked there were okay. So I think we based some of these rules and regulations more on fear and guesswork than actual evidence. And I think it was the right thing to do at the start when we genuinely had no info and we genuinely were terrified that this new virus was out. But now that we learned so much more and we see how it's transmitted and how the majority of 98% of people recover and do well. That's on island. We don't have to look elsewhere for numbers. If we consider our cases and our recovered numbers and the number of deaths, which of people who haven't been autopsied, by the way, you consider all those things, we still have less than 1% of people who have COVID-related deaths. Definitely not proven. So I think that the masks were a good idea if you're symptomatic, if you're spreading droplets, if in that setting, but it's time for us to evolve with the information that we have now.
Exactly. And in fact, we have some information and we don't really utilize it, such as 6 feet or 3 feet of proximity with the person for 15 minutes is really the transmission, the most critical mode of transmission. And like she said, asymptomatic people. So I just don't feel that we are really trying our best to evolve past COVID. And there's just still so much fear mongering. Fear is a tool. So, for example, wearing masks. I don't think any of us want to live with wearing masks for the rest of my life. So what's the out? What's the end game with masks?
Really, we're wearing them correctly anyway. I like a little giggle every now and then, but to see how the masks are actually being worn in real life, it's, maybe because I'm like a little academic, it's hilarious to me. It's different. You got the mask, right? See, I'm so glad somebody else is laughing because it's
crazy.
It's what really happens in real life is is not really going to create the same prevention. So if I was in the hospital or in an acute setting looking at a symptomatic patient, I had the proper gear, then yes. But you have people who are walking around, establishments pretty now you can't really go in without a mask. People got the mask like this, they're talking to you. I say, oh, I can't hear you. So then they put the mask on
and get closer to you.
I know. I'm like, wow.
That's for
like
the
we've just gone crazy with this thing, seriously.
So that's for the general public, but somebody who may have a lot of comorbidities or who are immunocompromised, how is that different?
It's very different. And you said it, and I'm glad you did say that. It is very different. And I think that is what Dr. Peets-Talbot was alluding to, or even Dr. Ossoran, is that, yes, let's use this information judiciously. Let's take what we know and use it in the best possible way that we can both prevent the transmission of COVID, keep people safe, and live a somewhat normal life.
And we're not discounting that COVID is real. I don't think any of us believe that it's fake. So we're not saying to just go on as normal and pretend that it doesn't exist.
Correct.
But manage it accordingly. I think we have only managed it as this is a deadly pandemic. We have to do this.
Here comes COVID.
This will fix everything. Just this one narrow narrative.
Yeah, exactly. Look at the whole picture rather than just rely on the vaccine.
Yeah,
and now we're learning about this.
Yeah, I don't think, like I said, I don't think the vaccine is our savior. I mean, I think the fact that you see so many variants emerging, which was not part of the initial conversation, coronaviruses historically do not change that rapidly, so we should be fine with once we get a vaccine. And yet, once we had that, all of a sudden we started to see the emergence of other variants that were challenging the vaccine. Not that it overcome it yet, but it showed that a virus still does not, by definition, change from what we know about viruses. Viruses seek to survive in any way possible, and they will mutate to fit their environment. So the stronger you push, the stronger they will push back. And so ultimately, because you have to remember, a vaccine doesn't cure a virus. The vaccine just introduces a part of that virus to the body and then allows the body to do what it's supposed to do, which is to protect itself. So I still have yet to understand how we cannot allow the body to do that and protect it from overshooting the mark, which is how most people end up, succumbing to this disease. Is not because the virus overcame them, but because the body's immune system went haywire. What we need to be doing is, instead of putting down all of our cards now and saying, okay, we have a vaccine, we can just give up everything else, is try to figure out what distinguishes those people who got sick and died from those who got the virus and never even felt it, and then seek that as the ability to actually get people back to work. We don't close down our islands when flu is raging. And flu kills people. Flu kills people. We don't report the amount of flus that come out, and yet proportionally, flu kills more children every year than this virus had. And yet, do you see us forcing our children to get vaccinated? No, we don't, because we realize that we have other methods of treating it. We don't realize this now because we're not speaking of it. It's the hush sound that if you dare speak about it, God forbid you're a doctor that speaks about it, all of a sudden you will be pushed into the background and made to look like a quack. And that's simply not true. And the more and more evidence that comes out, the more it's going to be forced into the light so that people see that I don't have to sit at a bus stop by myself wearing a mask, ride on my bike wearing a mask, or if I catch COVID, go home and wait till I get so sick that I have to go to the emergency room, and then somebody's going to, under the corner of their breast, say, I told you should have gotten vaccinated a long time ago.
Or out loud to your face.
We're treating people like imbeciles.
Right. Although I think I remember asking, and I think it was the former chief medical officer, but it could have been the health minister at the time, very early on, because I wanted a marker, and I asked how many flu deaths Bermuda has in a typical year, and the answer was 2 to 3. So you're smiling. Is that not true?
Well, I think we have a problem with, here's the thing, I know in my office as a routine, if we get flu symptoms, we treat you. We don't diagnose you by sticking something up your nose and saying, okay, this is flu. Now we can go ahead and do what we have to do. We treat you. So there are probably a lot more flu that is out there in Bermuda that we never take account of because we do not go and culture everybody's nose and swab them to find out if it's flu. We simply do our job, which is to treat you in the way that we know how to treat you. And the same too with COVID. If given enough tools, every doctor out there, GP, FP, whatever, would be able to say, okay, you have this, let's go ahead and treat you and then make sure that you don't get any sicker. All we have right now is just testing and wait.
I don't know if Dr. Ossoran or Dr. Dowling would speak to this as well, but I'm also concerned that some of the COVID deaths are also being inflated, the death numbers, for reasons that I know of clients who had stage 4 cancer and also got COVID, and they was already terminally ill and palliative and happened to get infected with COVID and died, and then it was considered a COVID death. Like that, some certainly with some of the numbers makes me take a pause and question if it was truly a COVID death.
And remember, some of these, what you're talking about, were rules and regulations that were handed down from governing authorities that this is what you must do. Yeah. And, when something like that happens, what do? Your hands are somewhat tied, you push back. I'm glad you mentioned about how we handle children and the flu, because what's happening with children now and the inoculation effort, I'm very, 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 very concerned about it. I think it is really, really tragic when we have a population of people who are not strongly affected by COVID-19, and then we want to yet subject them to an experimental therapy that we have no idea of the outcome on a growing child. It's criminal in my mind. I'm sorry.
Yes.
Okay, so we went way past our 30-minute mark, but and the comments are still pouring in. But I just want to give people a chance to have the last say here, and we'll start with Dr. Frith.
A last say. I would just like to basically say to folks, use common sense during this time. Don't buy into the fear. Work at maintaining a healthy regime and using supplements, using food as medicine, exercise, just keeping it simple. The one thing that I find right now with folks is that they are buying into the fear and the brainwashing by having the airways bombarded with vaccine ads, and everything is about vaccine. I literally tune out from listening to the news anymore. There has to be a healthy way to keep your psyche healthy as well. So in closing, I would just like to say, keep it simple, use your herbs, use your supplements, and use your food as medicine.
All right. Dr. Dowling.
Goes to show you 30 minutes is never enough, no matter what we do here. Listen, I believe in the freedom of patients to choose. I believe that this is not a matter of don't use vaccines. I think this is a matter of tell them what this vaccine is. Tell them that it is actually not a fully vetted vaccine. That no matter what somebody tries to tell you on TV, that it is not full. That's why it's under emergency use authorization. If you do not, and please do not believe me, go and do your own research. Don't believe the minister who is a lawyer. She's not a doctor. Go and do your own research. We have many different ways of treating people now. People do not have to die from COVID, but you have to be reasonable as a population and a community to expect that your government and your insurance companies will give you those tools to, instead of just waiting for you to get sick and die. That's ridiculous. It's not fair and it's not just. It's unjust.
Okay. Just as a question, so we know that's under emergency approval in the U.S. The Pfizer
Emergency authorization, not
emergency authorization. So let's say in a year's time, where it gets full approval, then you'd be backing people getting it.
That assumes that I don't back people from getting it now. I actually do encourage some of my patients to use it. However, if we're going to look at the science also says, listen, women get breast cancer. So should we now encourage a lot of women to cut off their breasts because there's a risk of breast cancer in general? Or do we target those people who are extremely high risk for doing something that in itself has a risk? The vaccine has a risk. I have a patient in the hospital right now because of what the vaccine has done to them. So I know the vaccine has risk. Whether people choose to ignore it or accept the risk and still go ahead and get it, that's their choice, not mine. Do not let a doctor that thinks they're God, do not let a politician that thinks they're God make that choice for you, either directly by telling you to do it or indirectly by saying, you can do it if you want, but if you don't do it, you'll be locked in a room for 14 to 28 days. That's the same thing as far as I'm concerned.
Okay. Dr. Flood Robinson?
You know, I want to go right along with Dr. Dowling. I think that people really have to be resilient and be intuitive and be brave and stand up for what you want to see occurring. He is absolutely right. There is absolutely no merit to punishing people with a huge fine and a 14-day incarceration period just because they have chosen not to participate in a trial effort to find a vaccine that works against COVID. COVID is a curable disease. If you want to learn more, please visit the Frontline COVID Critical Care Alliance website. There is a wealth of information on the efficacy of ivermectin. That means the effectiveness. Ivermectin cures COVID, not in 100% of patients, but in a very strong 85 to 95% of patients. And if you combine that with the 98% or more survival rate of COVID, do not be afraid. Do not be coerced into using something that you're not comfortable with because you are afraid of dying from COVID. Use your preventative measures, strengthen your immune system, get your health in order. This is an excellent time for people to really focus on why it's important to be healthy. This is a message that all of us in our practice have promoted long before COVID, and we will continue to do so long after COVID. Your health is your greatest wealth. Protect it, and that includes not subjecting yourself to something that you are uncomfortable with because the outcome has not been shown to be proven to be safe. Not yet. It takes time for that to occur, a long time. So be brave and be resilient and don't be coerced and forced into something, and stand up against the things that you think are not correct. And if you don't believe that you should be incarcerated because you choose not to take the jab, then speak out about that and join us as we push back against it.
Dr. Peets-Talbot?
So what else is there to say? No. Right. So I laugh a lot because joy and happiness is a great way to build up the immune system, whether you have been vaccinated or not. So what I would love people to do is find a joyful and happy place. Do things that you love to do, things that serve you. Don't take yourself so seriously, but also stand in your power and stand in your intuition that you have for yourself, and know that everything is going to be okay. And then if you laugh a little, then that's even better. So that's all I'll say about that.
Okay. We're going to go to Dr. Ossoran, but we're going to extend this by another 10 minutes. And if you have a question for any of the doctors, just put them in the chat and we'll put them up on the screen, and the doctors can answer them. So if you have any questions, put them in there. And we'll go to Dr. Ossoran.
I think I would just like to remind people that try to ensure on your end that the information that you're receiving is accurate. There have been lots of cases, even comments among colleagues like, what are we supposed to do? Wait for the safety profile, and millions of other people die. If you look at global death rates, they haven't drastically changed during this pandemic time. We are reporting numbers more, so you're more aware of how many people are dying, but the numbers haven't jumped drastically to show, oh my God, 1 million more people died in the US than they would in another year. More deaths are attributable to COVID, however. So just making sure that we give objective info. If we're going to cite studies, then remind people, okay, for the COVID study where it says it was 95% efficacy obtained, it was in a reputable journal that was printed. However, that was 2 months of data. 2 months doesn't indicate how safe something is for humans. We have people declaring that it's safe in pregnancy. In Bermuda, we're guided by the UK system, and the authorities in the UK, as of June 4th, 2021, declared that they cannot reassure us that it is safe and that it shouldn't be given to breastfeeding women. And this is while we have colleagues, unfortunately, saying, oh, the American College of Obstetrics and Gynecology declared that it should be used. They said it should be used. That is not a declaration of its safety. The companies themselves have not declared it to be safe in that population. So I just think that the information we put out should be responsible information, because as healthcare professionals, we end up making decisions for lots of people, even though we don't necessarily want to. We want patients to have autonomy, but they rely heavily on the information you give them. And so I think we have a responsibility to ensure that the information we are given is objective, not one-sided.
And accurate.
Yes.
I know, like, some people are critical of the studies that have been done for the Pfizer, Moderna, Johnson & Johnson, and AstraZeneca. And I think the smallest one of those was like 30,000 for either the AstraZeneca or the Johnson & Johnson, 33,000, and the other Moderna and Pfizer were over 40,000. And there's been lots of studies done on ivermectin, but the largest one, and I'm going back, like, I haven't looked at any of the studies for the last 45 days, but I think the largest one I saw for ivermectin was 600 people were in it. So why should we trust a study with 600 more than a study with 43,000?
I guess I could start on that. For any one study always has the ability of having a flaw that will kind of skew that one study. But when you have many studies across many different areas, that you're able to bring those bits of information together, hence why they talk about metadata analysis, that actually has a better accuracy of giving you a truer picture. So you also have to remember what these studies were ultimately about. The study by Pfizer and all the other drug companies were about proving that their drug works so that they can sell it and make money. The studies that come out about ivermectin is about proving that this drug works so that you will give it to your patients so that they will survive. Most of the people who were doing this were not doing this to prove anything to anybody. They were trying to get their people healthy and gave them the data. A lot of people actually use it and never turn in studies because they're going to be considered once again to be a quack. if it works, it works. Listen, if I give you a medicine and you get better, is somebody simply going to say, hey, there's no proof that medicine works just because he got better? No, I agree. Let's give it to 10 people. Let's give it to 100 people. But there's nobody out there, including governments, who are willing to put out that kind of money to find out if this thing works. They're willing to pay big companies to do it, but not small drugs that will actually make no one any money, but will actually save lives. Somebody put out here on this website about, do we just expect Bermuda to open up under the current situation? We have a potential to, with a drug that you give twice in 48 hours within a week, being able to reduce the level of viral load in anybody who is actually positive, let alone somebody who's negative, who comes in this island. So even if you didn't give it to everybody, if you offered it to everybody who came into this island, instead of saying simply go and lock yourself in a particular hotel for 14 days, you have the potential of forming at least a chemical block on that virus entering into this country, along with those who are immunized via vaccine or immunized via their own immune system because they caught it, which we do not recognize right now, but is equally valid. We have the potential of protecting any citizen of this country from ever going back to where we were again. Any of them. But how do we prove it to you? How do we prove it to anybody else? We can't. We're simply doctors. We don't have the financial ability to give 10,000 or 40,000 people some money to go and test this drug. You have to either believe us or you don't. You believe us every day when we say, hey, go get this blood test. You believe us when we say you have this disease, take this medicine. And all of a sudden, because we say we have something that can save a population, governments make us look stupid and people will not trust us anymore. I'm sorry for our people. I apologize, people, for the doctors who have decided to just drink the Kool-Aid and tell you go get a vaccine, even though there's a small chance that you might die, or even though there's a small chance you might get an illness. That is not acceptable.
There's so much about medicine that the average person doesn't know. And there's so much about research that I have learned along this journey. If I write an excellent paper with sterling results, but no one publishes it, is it still an excellent paper? And if I do excellent research that shows wonderful results, is it still excellent research if everyone simply ignores it and says, no, it never happened? The amount of money that is required to go into clinical research is astronomical. And another thing, clinical research is invalid if there's no control group by which to compare the results of your research. Where's the control group in the vaccine? We truly are asking, the powers that be are asking that there not be a control group, that everyone become vaccinated. So how do we really know that the vaccine was all that effective in comparison to not using the vaccine? Well, the millions of dollars required to perform clinical research are not available for a cheap, inexpensive drug that no one is going to benefit from.
There's still 40% of the population of Bermuda who don't have a vaccine. So
you mean now?
Yeah, right.
But where is the research to compare? Research is a comparative exercise. Mm-hmm. There's a lot more numbers that would need to be crunched before that was something that useful for us.
Yeah, but I know, like early on when we had this latest wave, just comparing the numbers of people who weren't vaccinated, who got COVID that they were publishing, and the people who had full vaccine, it was like 1 in 123. I'm approximating it in my head. I don't know what the exact figure because I don't have it sitting right in front of me. It was like 1 in 123 people who hadn't had a vaccine got COVID, and it was something like 1 in 2,000 who'd had both vaccines who got COVID. I mean, that's a
But
wide.
What about people who were exposed to COVID and did not get COVID versus someone who was not exposed? Research, there are so many parameters that have to be adjusted in actual true clinical research, much more than just a simple observation that, our hospital population are primarily non-vaccinated and et cetera. So that's what we're saying here, is that there are a lot of moving parts that are not in motion in order for us to grasp the fullness of what is really going on.
And Mr. Burgess, we are not saying that the vaccine doesn't work. I think you keep kind of suggesting that we're saying the vaccine doesn't work. We're not suggesting that. We're suggesting that the vaccine might work very well, but it might also have certain side effects that people don't want to disclose because they don't want people to take not to take the vaccine. And we're saying if you don't take the vaccine, you have options, which people are unwilling to give you because they're unwilling to at least look at the data objectively. If you look at it through a lens that it's either vaccine or nothing, then you will not be objective. And unfortunately, I think we're very objective because most of us here who can, convince people to get a vaccine based upon their pre-existing conditions will give them an honest answer. There are some doctors out there who will not do that because for them, it's all or none. You're either in or you're out. And if a few people suffer, then they're the ones who have to take the hit for the population.
And take the hit indeed, because if we're not offering people treatment options that are effective and safe, then we're essentially saying that if you don't get the vaccine, poor you.
Right. Now we're up to our hour mark, and I appreciate everyone staying for an extra half hour tonight, longer than I promised at the beginning. But again, thank you all for taking part tonight, and appreciate your time. And I think my boss is.
Don't forget to watch BeyondThePandemic.tv, also showing on Channel 82.
And that website again is www.beyondthepandemic.tv.
Correct.
All right. On behalf of Bernie's, we want to thank Dr. Ossoran, Dr. Peets-Talbot, Dr. Dowling, Dr. Flood Robinson, and Dr. Frith for being here tonight. And as usual, have a very beautiful evening.